Hi, good afternoon, everyone. This is Tess Pariachi from Health Systems Trust. I'm the Acting Director for the Health Systems Research Unit and also the Technical Lead for the National Health Research Database. We're very pleased today to have the KwaZulu-Natal Department of Health, Health Research and Knowledge Management team here with us today. We're co-hosting with them, and they're going to be taking us through the process of receiving approval to conduct research in KwaZulu-Natal public health facilities. We anticipate that this webinar will be about an hour long. The presentations will be done in two different segments. We'll have a segment that will run from 11 until 11:25, and thereafter we'll have 5 minutes for questions. And then we have another segment from 11:30 to 11:50, and then another 5 minutes for questions. If we have more time for questions, we will do so. I'm going to run through some housekeeping rules, and I don't want to take too much of time away from our presenters. But if I can please ask for all of you to put yourselves on mute, and we will not be using webcams for this session. In the interest of time, just to ensure that we stay focused and on track, we would like to ask you to please submit your questions and comments through the chat box that you'll find on your taskbar, at the GoToMeeting taskbar. The facilitator, who will be myself, will collect all of the questions submitted during the presentations, and we hope that you will engage actively using this kind of function. Unfortunately, with this kind of online platform, it's very difficult to engage in an online discussion with so many people online. So I hope you'll appreciate the system that we've put in place. We do have agreement from our presenters here today that if the question you have posed or the comment that you have put forward has not been responded to, we will provide you with an email or a contact number for you to engage with the presenters here today. I'd like to also run through the basic reason behind the NHRD webinar series. It's really just an innovative capacity strengthening initiative as part of our NDoH funded support to provincial health research committees. We've introduced the NHRD webinar series in an effort to ensure that HST support to provincial health research committees is relevant, innovative, and tailored. Through these online interactions, HST hopes to create a supportive community of learning, primarily for PHRCs, but like today, we'll also open it up to the greater research community. The webinar series will endeavor to facilitate a productive online learning community dedicated to ensuring that PHRCs are better placed to achieve their mandate of coordinating and managing research conducted in public health facilities. Just to run through some of the key objectives, we, through HST, want to support the marketing and communication efforts of PHRCs in terms of their research approval processes. We understand that, the only way that we can facilitate research successfully within provinces is to ensure that everyone's on the same page in terms of the process. So we want to support the PHRCs in this regard. Secondly, we want to support knowledge translation activities within PHRCs so that results from potentially high impact studies that are conducted within provinces can be disseminated more broadly to the research communities. And this is really just to complement many of the activities that the PHRCs are leading within provinces. So it's one of many activities within provinces. And finally, we want to support the evidence-based decision-making activities within provinces and really support the reflective practices within PHRCs and within the broader research community as well. So we hope you will engage with us today, that you will find the presentations informative and helpful. Without further ado, I'd like to present today's presenters. Our first presenter is Ms. Rizwana Desai, who is the Deputy Director of Research at the KZN Department of Health, PHREC. And our second presenter today is Ms. Gugu Kumalo, who is the Deputy Director for Research as well. And so welcome, ladies and gentlemen. We also have, to support Rizwana's presentation, Mr. Kolani Kaba, who will also be presenting some of her slides, and in fact he will begin the presentation on behalf of the KZN PHREC. So, Mr. Kaba, can I hand over to you?
It's still a morning. Good morning, everyone. As Tess has just said, my name is Kolani Kaba. I work in the Department of Health in the research component. What I'm going to do as part of the presentation of the process for obtaining research, I'll present. If you look at the overview here, I'll present on the establishment of the Provincial Health Research Committee, the functions of the Health Research and Knowledge Management component, which is a secretariat of the Provincial Health Research Committee, the process for research application, and our review process. And then Rizwana will take over and present the reports. The establishment of the Provincial Health Research Committee The Provincial Health Research Committee was established as mandated by the Health Research Policy of 2001. So you see at the top of the slide there, we have the National Department of Health, and then the Health Research Policy establishes the National Health Research Committee. We then have the Provincial Health Research Committees in each of the 9 provinces. But then if you look at the third tier in that slide, you'll see that the KZN Health Act establishes the Provincial Health Research and Ethics Committee. Okay, and as the Secretariat, we have the Health Research and Knowledge Management component, which is basically providing assistance to the Provincial Health Research Committee. The system is a bit slow this side, so please bear with us. Okay, so what are the functions of the Provincial Health Research Committee? It is mainly to coordinate health research throughout the province, to assist in priority setting. This is research priority setting, identifying key research questions, and lastly, to work with stakeholders in the promotion of health systems research. So we have a process that we engaging in terms of identifying priority research setting and the questions. We are on the second phase of that process in this year. This slide presents the functions of the Secretariat, which, as I said, it's called the Health Research and Knowledge Management. Secondly, it develops research capacity to improve service delivery. That's one of the key responsibilities, to develop research capacity within the department so that we improve service delivery. It provides research oversight services, develop a functional database, to formulate and maintain the research policy, the research strategy, and research protocols. And lastly, to analyze, review, and recommend research proposals that are submitted to the Provincial Research Committee. So this is the structure of the component. This component was established in 2007, and it's part of a bigger unit called the Health Services Delivery Planning, Monitoring, and Evaluation. We have a director and 3 deputy directors who are, among other duties, to make sure that the Provincial Health Research Committee functions effectively. What's the process for application and approval of research? So in this slide, you will see the process begins with protocol development, then ethics application, and I want to highlight that we do accept provisional approval. And then the researcher, once you have ethics approval, you then approach the institution or the health facility for support. And once you have that support, you need to you make sure that you have an official document in the letterhead that says the facility is willing to provide access so that you can implement your study. Once you have all those 3 documents, you then come through to us to apply for approval on the NHRD, and this is only applications done online. We do not accept emailed or hard copy applications. Then the last step is the Provincial Health Research Committee approval. What are the documents that are required? Firstly, your research proposal, your ethics clearance certificate, your institutional support, which you must get before coming to the Provincial Health Research Committee. This is different. Some of you might have questions about institutional support. It's different. We know that in the Western Cape, for example, PIs or researchers do not necessarily have to contact the site to get support. But in terms of KZN, we need that letter of support. And we find that quite a number of researchers would submit their applications online without having this site support letter, and that delays the process because we then inform you that you must go back and get the letter. So that will delay the approval process. But then in terms of clinical trials, there are further documents that are required. For instance, SAPRA clearance, our clinical trial application form, it's not a long form, it's quite quick to complete that form. You need insurance certificate and dispensing license. So in terms of institutional support, we advise that researchers submit their proposals and ethics clearance certificates to the hospital manager. And in that application, you have your synopsis of the study, your then study date and completion, your design, your study participants, your recruitment processes, which departments, and there are other critical questions you can see in the slide there that the hospital CEO will have to look at. For instance, will there be additional load for nursing? Will the study require that nurses participate in the recruitment of patients? Will researchers use facility support services? And all those important questions there. In terms of the process, then, when you're seeking institutional support, the last bullet point there, it says, for less than 4 facilities, you seek support or institutional support from individual facilities. But then if you have 4 or more facilities, you must go directly to the district manager to obtain that institutional or site support letter. For 4 or more districts, then you can contact the program manager for that particular program. For example, if it's a TB study, then contact the TB program manager in the province to get the support letter. So this slide presents the review process. Once you've submitted your documents onto the National Health Research Database, we then download and allocate the application to one of us for review, and then once we have recommended the approval, we send the application to the Provincial Health Research Committee chairperson for final approval, and that whole process takes a maximum of 3 weeks, and we try to make it shorter than that, but it's a maximum of 3 weeks. You then get a decision whether your study has been approved, whether you have to make any, or whether it's been rejected. But in terms of clinical trials, the process is much longer because there are other steps in the review process, in that we send the clinical trial application to specific reviewers within the department, such as program managers, and that takes much longer. And the application is approved not by the Provincial Health Research Committee chair, but the head of health. And that process takes a turnaround time of 3 months. Thank you. I'll hand over to my colleague, Rizwana.
Good day, and thank you for joining us. So Kalani has spoken about the application process and the review process. And the next thing is the report. We are currently going to present on the report for the 2017-2018 financial year, because we're still in the current financial year. And once this financial year completes, then we will also do a report on this current financial year. And why we want to present to you the report is whatever you have done as an applicant will then be stored as also part of the database. And then, because as a function of the PHRC, we are coordinating mechanism, as well as the Secretariat that has to answer to the PHRC, we have to do reports. So we do have guidelines in terms of how to go about applying for research when you want to conduct a research study in the KZN province. And why I'm bringing this up is because it affects then the report as well. So there were 2 major changes during the 2017 financial year that has an impact on our report, and that also has an impact on you as an applicant. What the PHRC has decided was that also just not only clinical trials and observational studies must come through to the PHREC, but also community-based trials. And the reason for this is because of the KZN Health Act. And it's in this act, it's stipulated that all research in public health institutions, or in the province, must be also reviewed by the PHREC. Also, the second basis for this was that community-based trials might also recruit participants, although it's not done in public health institutions, but it might recruit participants from public health institutions. And the next one was, we realized that the process already is quite long for researchers applying to conduct studies in our province. So we wanted to also streamline the process and also assist researchers instead of making it a frustrating process for everybody. So for clinical trials, what we're trying to say is, whilst you are also applying for SAPRA approval as well as ethics approval, you may also apply online to the Provincial Health Research Ethics Committee at the same time. So we will start doing our review processes, because you will be supplying us with your protocol, and you will be supplying us with your clinical trial application form, and institutional support will then come as well with your application. And then once you've received your approval from SAPRA and ethics, then final approval will be given to applicants. So what Kalani has told you about the establishment of our component is that we coordinate research, and this is 80% part of our unit function. So we are obliged to also report on what we do, and this forms part of our annual health research report, and we do it according to the financial year, so it's done every year. And the component that we report on is the submission and review of research proposals, why studies are being conducted, the applicants, where do they come from that have applied for research permission, and whereabout is research being conducted within our province, and what type of studies are being conducted in the province. And we use the NHRD reporting tool in order to provide this information. And what we normally have to do is go and download the raw data to analyze it, because obviously, we want to look at, especially the last two bullets, the district that which research was conducted, the type of studies conducted per district involves a bit more analysis. So we have to just download all the raw data. So this slide just tells you from our inception from 2008, which is the first point on the left-hand side, up until the 2017-2018 financial year, which is on the right-hand side. So this gives you just a picture of, in the past decade, how many proposals have come through to the PHRC in KZN and how many we've processed. And there are a few things. The blue block will tell you how many applications have been submitted to us, while the red one tells you how many applications have been approved by us. And you might not see what's written, but the orange one is something that we call term pending applications. And why this is important is because we are a coordinating mechanism and not a regulatory body, we don't outrightly reject proposals. And so if we have any query regarding a proposal during the review process, we give you, the researcher, a chance to provide us with more details or answer any questions or queries that we may have regarding your proposal before giving you complete approval. So you'll see in the last decade, the number of proposals that have come through to our province has increased exponentially. And in the 2017-2018 financial year, on the extreme right-hand side, you'll see we actually broke the 500 record. So in that year, we've received more than 500 proposals for that year. And then we break it down a bit further to show you that we review each and every application, but 86 of them have been approved, and I've explained to you the status called pending. And what this is sometimes maybe you might have a query regarding a proposal, or sometimes applicants are not providing us with the required documents that Lani had just mentioned earlier, and or maybe there might be something outstanding, and we've already commented or contacted you as an applicant, but haven't received any feedback as yet. So it's actually like your application is suspended in between being approved and going forward with the process. So we look at why these studies have been submitted, or why people are conducting the studies. And we, from our own province, have classified it according to academic studies, operational studies, and clinical trials. And why we've done this is because obviously as a body, we would like to see what sort of studies are being conducted that are health systems related, because our mission ultimately as the province is to improve the health and well-being of our population. And operational studies then tell us about the health system itself and how we can improve it or what is happening. And then because of the burden of disease we see in our province, we as a province experience a double burden of disease such as HIV and TB together. There are a lot of clinical trials that are being conducted in the province because of the double burden of disease. So we also need to see what's happening with the clinical trials and what comes out from these clinical trials as well. And that's why you will see the process for applying for clinical trials is a bit more rigorous than normal in a normal observational study. So what we found is that 80% of the studies are actually academic studies that are coming through to us. And the reason for this is we see that we have a lot of academic institutions in the province, and most of these institutions have masters and postgraduate studies that are occurring. And as a requirement to fulfill your qualification, you are required to conduct a research study, whether it's big or small. As a student, you have to submit a study. Also, in the past few years, we see that registrars, as part of their training as well, they have to also conduct a research component as well. So we see that most of our applicants are academic studies, there are a few operational studies, and 4% of the studies that we receive are actually clinical trial applications as well. Then we want to look at our profile of the province and across the 11 districts where our studies are mainly being conducted. And you can see that mainly eThekwini has over half of the studies that are being conducted in the eThekwini district, and then the next Ngunglovu. And if you know the province, you will know that eThekwini is the largest district in our province. It's an urban district as well. It's also a metropolitan, so there are lots of resources as well in this district. And then the next one is Ngunglovu. And studies are not only restricted to the one of the 11 districts, but there are studies that are being conducted in all districts as well. We then break it down further to see within these districts what type of studies are occurring. And so we just did a sort of cross-tabulation of academic clinical trial operational studies against the district. And you see again eThekwini comes up. And the reason for this is because the main academic institutions in the province is found also in this district. And then also Ngunglovu also has a few academic institutions. You'll see that UKZN, the University of KwaZulu-Natal, is split between Pietermaritzburg in the Ngunglovu district as well as Durban, which is in the eThekwini district. So it relates back to 80% of the studies that come through are academic studies. And you also notice that clinical trials are also in eThekwini. And the reason for this is, as we've said, that it is a large district and the largest number of public health institutions are also in the same eThekwini district. And you also have some in Ngunglovu district. And notice there are two clinical trials that are in Utukela district because there is also a research site, clinical site that is based in the Ladysmith area, which is found in the Utukela districts. So operational studies also at eThekwini again and Ngunglovu again. So we've also wanted to see where are these studies emanating from, which sort of organizations, and we then broke it down into academic institutions, government institutions, research organizations, non-profit organizations. We've also received applications from international academic institutions and non-governmental institutions as well as private companies, and we see that again most of them are coming from academic institutions and a few from also government institutions as well. This next slide tells you about the profile of studies, which is according to the burden of disease. And just to note that this is the information that is on the NHRD. So when you as applicants are applying, you then indicate that which area of the burden of disease is your study related to. And you'll see that most of it is clinical studies and doesn't necessarily mean it's clinical trials, but it might have to do with clinical management of certain disease. And what we've done is we just did a bit of a basic analysis. So we haven't looked at your, you are allowed to choose more than one option with regards to your burden of disease. So we've only looked at the first option that was chosen. And this is why you might find also a high number or percentage is clinical, according to clinical burden of disease, is that people have chosen first as your first choice, your clinical burden of disease, and then your next choices might have been in whichever field it was applicable to, like say, HIV or TB, etc. So there are a lot of studies that are done on the health system itself, and those highlighted in green are actually the quadruple burden of disease for the country: child health, HIV/AIDS, non-communicable disease, women's health, TB, so and injury and trauma. So it's good to know that there are studies being done on these sort of topics as well. We then broke it down into the burden of disease according to the purpose of the studies, and you'll see most of them are clinical studies, especially the academic ones. Clinical trials are also clinical as well. Operational studies are also being done in the child health field as well. So we use the NHRD to compile these reports. So the NHRD has been a very good operational tool that we are using, and we welcomed the NHRD when it was first developed, because it was a system that actually we ourselves were looking into, because we needed a system that could reliably collate all the data and give us information, and we were just using an Excel spreadsheet, and of course that is also just limited. So when the NHRD was developed, we were happy to be on board with the system and to participate as part of the development of the NHRD. So we look at the NHRD as an operational tool, and I just want to say first of all, this is just the experience of us as KZN, and this is from the not the applicant side, but as the user of the NHRD as the administrators. There were a few issues that we found, and hopefully that we think that we can work together and hopefully resolve these issues, and maybe others also have a way of going around these issues that we might be encountering, that you might have a better way of going around these issues. So because as KZN we find that we have a lot of clinical trials, the system itself cannot pick up which one is a clinical trial and which one is not, because obviously you need to do a bit more analysis, and the only thing that will tell you whether it's a clinical trial is maybe the title of the study. And of course, as we know, most research proposals will not in the title say it's a clinical trial outright. Because of the PHRC, we are also accountable to senior management of the department, and a lot of senior managers would also like to know more information about clinical trials that are being conducted in KZN. So we actually have to use another spreadsheet to find this information. And then again, something that's unique to KZN is we have our requirements that Nani had indicated earlier, and which is site approval. So it's just to tell us that the institution is happy to give you access to conduct your study there. And because it's not a mandatory document on NHRD, even though it's a document that we require, applicants are not submitting this online. And this might also cause a delay in the turnaround time, because then we have to come back to you as the applicant and ask you to please submit the site approval online again. The next point is we find is duplication of studies. And this is because we do ask researchers what is happening when we find the same title or the same proposal being submitted, and a lot of them say maybe there's a lag in their system, and then they continuously just press submit, and then it comes up quite a few times, and it then has an effect on our reports. Sorry, I forgot to mention the first point, and you'll see the green tick because we have engaged with HST and they have sorted it out. It's applicants are choosing request to access to NDOH instead of request access to provincial facilities. So what happens is when an applicant is applying, they actually choosing NDOH, and then it goes to the National Department of Health, and we as a province, even though we're an administrator on the system, we cannot see the application because it's gone straight to NDOH. So if you do not receive a KZ number, you then know that you haven't submitted to us, and we receive calls thereafter 2 or 3 months later. Researchers are asking, why haven't we processed it? Why they haven't heard from us regarding their application? And it's because they've incorrectly chosen where the application must go to, and they haven't received any response thereafter. And what they have to actually do is then reapply on the system, and of course this is another delay that might frustrate you as an applicant as well. So the HST have tried to ease this by just playing around and editing their page. So most of the time it has been working, but we do find that still people are, for some reason, still clicking requests to NDOH instead of to provincial facilities. Something else that we've picked up is that that might have an effect on the turnaround times for approval is that sometimes if there's an outstanding document or query, there's a comment function on the NHRD. And this is between the applicant and the administrator. And what happens is the comment is made either by the applicant or the administrator, and there's no, if there's no like sort of email notification that comes up to either one, you won't know until you log in and maybe you go to comment and you see that there has been a comment. And the same is applies when if you as an applicant are uploading an outstanding document, we as an administrator are unable to see that document once you've uploaded the outstanding document. Unless you call us or email us, then only we know, okay, you've uploaded that document. We also find that first-time applicants don't know where to access the approval letter. So you see your status has changed for your proposal from being currently a new application to then approved. But then you're waiting for an email of the approval letter. Meanwhile, it's actually on the system. Something else that has come up from the PHREC themselves is that we've noticed that maybe in the future there might be problems where researchers are holding the public health institution liable for any injury or harm that comes to them while they are conducting their research. And the legal component of our department has then actually advised against liability for this, that we actually request an indemnification to be added on the system that will then not hold the department responsible for any harm or that might occur at the institution. So I brought up these points, and I'm proud to say that we've had a very good relationship with HST, and we're always engaging with them, and they've been very supportive of the whole process. And it's a continuous process, and we are continuously engaging with HST, and we really appreciate everything that HST has done on the NHRD for us as well. Thank you.
Okay, so thank you, Rizwana and Kolani. We're running a little bit over the time allocation, so I'm going to open up maybe just 2 minutes of questions. I'm just going to have a look and see the types of questions that we've received. And apologies for the initial difficulty in transmitting our screens. We seem to have had a gremlin creep into our system. Okay, I did see one question. Okay, there's a question from Themba Mulungu. He says, I missed the part on site support for research. Is it done after obtaining ethical clearance?
Yes, usually the process is after you obtain your ethical clearance, you would then go to your manager at your institution.
And if I can just add on that, usually ethics committees would say get a gatekeeper letter before you get the final approval. And some researchers would get confused and come straight to the province to seek gatekeeper letter. But in fact, the research ethics committees would accept a letter from the site as a gatekeeper before they give you final approval. So you get that gatekeeper letter from the site and then submit all the 3 documents on NHRD. Once we have approved and given you the final approval, you then take that letter to the ethics committee so that they give you final ethics approval.
Okay, and then again from Themba Mulungu, how are the ethical issues addressed with international researchers? Do they partner with local researchers?
Yes, they would have had to receive local ethics clearance as well in order to get provincial approval.
Okay, so those are all of the questions that I've received in relation to, sorry, Dr. Van Vuren has also asked a question. How can we be assisted in achieving class approval for the use of data from a clinic within an institution?
Hi, Dr. Van Vuren, it's Elizabeth Lutke here. Class approvals are becoming much more common in KZN. They're a well-recognized form of collecting data. So what our local university's ethics committee requires is a specific application form to be filled out for class approval to maintain a database over time. They usually stipulate the normal things like privacy and confidentiality of patient data. But once you have ethics approval for the class, once you have class approval for the database, you submit that class approval to us with the support letter from the facility or the program, whichever it is, and we would approve it in the same way that we would approve any other research application. What the ethics committee requires is that they are informed of any publications resulting from that database every year. So on an annual basis, the PI of the database would inform the ethics committee of any studies that have been done using that database.
Okay, and then we've got a question from Natsai Chimbindi. I need clarification. What if a community-based study or trial is not using any facilities? The online form doesn't allow you to submit without mentioning at least one facility. How do we go about it?
At the moment, we advise them to click the district where the study is conducted. There's always an allowance for a district, selection of a district.
Okay, can I clarify? So if you select the district option, it seems to imply you are getting information from the district office. So you're forced to select one of them.
Thank you.
So Natsai, you're right. You wouldn't be using information from the district office, but there isn't really another alternative on the NHRD at the moment. It's something that perhaps the technicality that can be worked out in the future, but maybe in your comment section you can just alert us to the fact that you're not using district data, but this is a community-based study and there's no other option for you to click. And that might be the best solution at the moment.
Yeah, and I think because this is a new inclusion from KZN, that they're going to extend their mandate into community-based studies, I think this is something that we need to maybe have a look at in terms of the design of the database as well. So thank you for raising that. Thank you.
Okay, okay, that's fine. Thank you.
Sorry, we're going to have to close the question session now because otherwise we're going to run over the time, and I don't want to assume that people are available beyond 12. So we're going to move to the next presentation.
Hi everyone, my name is Coco. This is the last presentation from the KZN team. I'm going to present on the use of the NHRD as a tool to assist the Provincial Health Research and Ethics Committee in fulfilling its mandate. The three main uses are to generate reports like the presentation that Rizwana has just done. The second use is that we use NHRD, the titles from the proposals to do a research prioritization process, which I'm going to discuss further, which is the major discussion on this presentation. And lastly, we use NHRD as a repository for completed reports. As a repository for completed reports, what happens here is when researchers have completed their studies, we request them to upload them on NHRD. Unfortunately, about only 5%, if I can estimate, of reports that come back to us. Most of the researchers, when they've completed their research, they never come back to us. So as researchers, we appeal to you that when you've completed your studies, you upload them on the same application on the NHRD. And this is simply so that the program managers can be informed about new developments, new findings from your study, to develop new policies, informed policies, and planning. And we would like that maybe going forward, there is like something that you can click on the NHRD, and you can say whether you want to disseminate your results by a meeting or by a publication, so that you can then be able to hear about your findings. As I've said, I'm going to discuss at length the research prioritization process that I will call RP process going forward. The RP process is done as mandated by the National Health Act of 2003 and the National Health Research Policy, and it mandates the Provincial Health Research Committees to manage and assist in setting priorities. The priorities are reviewed every 5 years, and currently from the National Department of Health, there is no gold standard or a method to conduct these prioritization processes. It's tailor-made to suit each district, because each district and provinces are very different. The purpose of setting the RP process is to basically ensure that all the health needs are met in each province. And also, we know that the National Department of Health, it sets priorities, I think, every 5 years as well. And every province has to then align with these priorities. And also the RP process, it's an opportunity to form relationships with different stakeholders and communities and institutions, like giving them a voice to direct research and saying what research they want to be conducted in the province. In KwaZulu-Natal, we were fortunate to do our first RP process in 2013, and we involved the stakeholders, as I've mentioned earlier, that it's an opportunity to form relationships and give them a voice. We invited the communities, local communities, traditional leaders, healthcare workers, all different cadres and categories, the research organizations, and academia. And what we did in this process is that we combined 3 to 4 districts into one workshop, and there was also a workshop for the whole KwaZulu-Natal province. So in the workshop, we will ask them to form groups, and in these groups, they will formulate questions, basically saying what research they would want to be conducted in their districts. And then we ask them to form themes around these questions, and then prioritize these themes according to the order of importance in their districts. What was the outcome for this process? We then had priority questions that were set by the KwaZulu-Natal Voice, and then we posted these questions to the intranet and the internet, basically sending back these questions to them and saying, here are the questions everyone in KZN to conduct and to direct research according to the priorities of the province. And so how does the RP process then fit into NHRD? The way we did it is that we took the questions that came out from the RP process in 2013, and we compared them with the research titles from the proposals that were uploaded on the NHRD between 2014 and 2017. And then we allocated them to themes, which is like a qualitative process. And then quantitatively, we compared the percentages of the same themes from the research questions and comparing them from the proposal titles from the NHRD. At the moment, because as I've mentioned, we do the RP process every 5 years. The 2013 one has been completed, and unfortunately I cannot divulge the findings because the results will be published. After publication, then everybody will have a view on how the needs for research in KwaZulu-Natal, if they were met or not. At the moment, we're doing the 2018 one, 5 years from the 2013 one, and we urge all researchers to kindly complete the survey. It takes just 5 minutes. The internal employees and the external people do have a link to access the survey, where you can say what research you want done in your province or in your local area, so that the research is conducted according to the needs of everyone in KwaZulu-Natal. Thank you.
Thank you so much, Gugu. I think that's a really exciting piece of work, and we look forward to seeing that publication come through. I think we've got some time for questions. I'm just going to have a look and see if anyone has posted any further questions. Dr. Van Vuren, I just want to note that we've missed a question earlier, so I want to go back to that question. You asked whether researchers require hospital ethics committee approval or only PHREC, for example.
Okay, so the hospitals usually don't have their own ethics committees, Dr. Van Vuren. The hospitals, if they have committees, those are purely research committees which are involved in providing the support letters that Xolani talked about earlier. So we in the KZN PHREC ask for ethics approval from a committee that's accredited with the National Health Research and Ethics Council. We don't accept ethics approval from any other committee that calls itself an ethics committee but is not registered with the NHRD. So just to summarize, you need a letter from an ethics committee accredited with the NHRD and a support letter from the institution or district where you will be conducting your research. Thanks.
Okay, and then Dr. Van Vuren, your question, who has the rights to data from databases, example tier.net?
All that data is, I don't know if owned is the right word, but the custodian of that data is the Department of Health. So in order to access that data, you would need to request release of the data from the data management unit or from the TB or HIV unit, depending on what data you're looking for. But you'd also need to fill out, you'd also need to apply to conduct research with that data in the same way that you would do to conduct any other research project. So you would ask for, you would need ethics approval from an ethics committee, and then you would probably apply directly to the program manager who controls the access to that data in order to get that data.
Thank you. And then we've got Philo, who asks the question, please confirm if an application to the Provincial Health Research Ethics Committee can be made simultaneously with PHREC.
Unfortunately not. As Xolani presented, we require you to have the provisional or full ethics approval before you come to the province for provincial approval.
Okay, those are all the questions that we have. We've got another 5 minutes if there are any other questions that you'd like to ask of the team while you have the chance and they're in the hot seat. Okay, we don't see anything coming through. So we've got 5 minutes. I think I just want to say thank you very much to the team here today. This is the first webinar. The first one we actually had was an internal one with all of the PHRC administrators, and so this is their first sort of fledgling, publicly available and accessible webinar. There is a question here. Can we have the contact details of the persons who answered our questions? Yes, certainly. We will as part of HST's support, we will provide that detail to you. And then if you would like to be part of a mailing list to get more information on other webinars that we will be conducting over the course of this year, we will provide you with a link and you can respond and let us know if you'd like to join that list. And with that, I'd like to say thank you to everyone. Thank you to everyone who has participated in this this webinar. We appreciate your presence and we hope to see you again at the next webinar. Thank you so much. Enjoy your day further.